Hello and welcome to the France 24 interview. In a year's time, the World Health Organization will have a new director general. Candidates are beginning to declare themselves. One of them is Philippe Douste-Blazy, who is a former French health, culture, and foreign affairs minister. Hello and welcome to the show.
Thank you.
You're a cardiologist by profession. You're also head of UNITAID, which is a global health NGO trying to buy some medicines for those in need. You're joined on the set by the health minister of Liberia, Bernice Dahn. Thank you very, very much for being there. Mr. Douste-Blazy, the World Health Organization is obviously an important organization within the UN system. It has been criticized for its handling of the Ebola crisis in Liberia and neighboring countries. Some people are saying it needs serious reforms. Are you ready to seriously reform this organization?
Of course. First of all, I would like to tell you that all human beings must have an equal right to health care. And now, more than ever, I am convinced that states need a strong, reformed, respected World Health Organization to defend the most essential of human rights, the right to health and health security. So thank you to the Minister of Health from Liberia, because he's a symbol of the combat against Ebola. She became the Minister of Health in Liberia at the peak of the epidemic, of the pandemic. So it is, for me, it is absolutely crucial to say that the WHO has to have a central role in the global health policy.
I mean, is your ambition to make sure the WHO, as it's known, intervenes very quickly if there's a pandemic? We talked about Ebola. Now there's talk about the Zika virus. There are also some chronic diseases. Do you think it needs to be much more reactive? Because in today's world, where people are traveling a lot, the response needs to be much quicker than it was until today.
Absolutely. The interdependency of countries are so important now. So we will create a fund dedicated to health crises. But also, we want to have some volunteers to go quickly on the ground to treat patients and also to train health workers on the ground. So we want also to create international security, sanitary and security center, a hub for analysis and to say very quickly what we have to do on the ground quickly.
Bernice, Dahn, I want to get to your experience. As Mr. Douste-Blazy said, you were on the receiving end, if I may say so, of the Ebola pandemic. There's been a lot of criticism about the World Health Organization. From your experience, what needs to be done to prevent such outbreaks from happening?
Thank you for the question. And from the Liberian perspective, it is advisable to build countries' capacities to meet the international health regulations. Now, we all signed on to the international health regulations, but the implementation of the regulations have been very slow. As a country, whenever they ask us to assess ourselves, we ask them to defer until the outbreak of Ebola. But we also see the outbreak of Ebola as an opportunity to build the systems to meet the international health regulations. If you listen to the news, you will hear, for instance, America spent about $1.2 billion to respond to Ebola in the 3 affected countries. Could we have spent that to strengthen our systems to prevent the outbreak to the scale at which it went? Yes. So this is the time to relook, refocus, and intervene.
This brings about the question of priorities, but also of funding. I mean, the WHO has been underfunded for many years. Is this If you are elected, there are two other declared candidates, one from Ethiopia, one from Pakistan. If you're elected next May, is this one of your priorities, saying we need more money because we may have volunteers, goodwill, good policies? If we don't have money, it's not going to work.
Yes, we need more money, and particularly from
Much more money.
much more money, and particularly from innovative financing for development. You said a few minutes ago that I am the founder of UNITAID. It's a small international body based on €1 per plane ticket. So we can continue to do that. But I want to come back on one thing, if I may. The most important role of the WHO is to build primary healthcare systems in each country to achieve a universal health coverage. It is a key if we want to improve global health in the world.
In your country, for instance, I mean, do you think there is enough sensitivity to those priorities, or also in neighboring countries? Because often there is a crisis. Okay, now this crisis seems to be over, and things continue as usual until the next crisis. Is there now a realization that, yes, those primary health centers need to be really up and running to make sure there's no such a pandemic in the near future?
Okay, what I will say is that during the outbreak, before it ended, Liberia developed an investment plan to build a resilient healthcare delivery system. At the moment, we still have the partners with us trying to help us build that system. But we also see some of the funding that were emergency related are being withdrawn. Now, if we do not build a system and you withdraw the support, it means you are putting us in a position where we'll go back to an emergency and you will have to respond. So there is a need to build a system to make it resilient so that we do not become a threat to the world again.
But isn't this also, the WHO cannot do anything? I mean, obviously, countries have to decide what their priorities are: to buy weapons, build infrastructure, or build hospitals. I mean, do you think maybe especially in Africa and other poorer areas of the world, there is also a priority for governments to decide where they should invest their money?
I think the government decided and developed the investment plan, like for my country, for example. The government is also investing in that plan, but the resource envelope is small. We take, for instance, for the next fiscal year, we have less than $600 million for everything for the country. The health sector alone will carry about maybe 70 million plus. That goes towards most of it operational costs, keep hospitals open, electricity, water, sanitation. So it is difficult to actually build the health infrastructure. I don't think it can be done by one person or one country. WHO is a technical agency. WHO gave us their support to develop the investment plan. The plan is costed. We have a lot of partners, but the partners have to rally around us to implement the plan.
And why do you think Mr. Douste-Blazy would be a good candidate to support your priorities?
Well, one of his platforms is to strengthen healthcare systems, and so we'll hold him accountable to that.
Will Africa support him?
I'm here as a professional colleague who has come to support him on this day that he's declaring his intention. The position for Director General is normally highly political, but also highly competitive and highly technical. Countries do make the decisions. So with his political agenda, as a friend, I can help him to market that with my other African colleagues.
Last question for you. Do you realize your role might be a political role? You will maybe need to go to heads of state and tell them you need to do this. You need to put the money there and maybe sometimes clash with them if necessary.
Yes, I think that we need a political leadership at the head of the
More
WHO.
than in the past.
And we have to reform the WHO also. Now we have the general director, and after we have 6 directors in regional directors. So now we have to organize a unique chain of command for crisis, for example. And we have to make a communication together. We have to speak together. So we have probably to reform. It is absolutely necessary to continue to decentralize to the regions a lot of things, but we have to work together more than before.
Okay, thank you very much. We'll be following that race for the helm of the World Health Organization. Thank you, both of you, for being on the France 24/7. Thank you for watching this interview.
Thank you.